Hi guys, in this video we will be discussing the vasculitis of the small vessels. So small vessels means the arterioles, capillaries or the venules, and we have two types of vasculitis which are basically affecting the small vessels. The first type is the granulomatosis with the polyangiitis, which is also known as the Wagner's granulomatosis, and the second type is the microscopic polyangiitis. So the first type is the granulomatosis with the polyangiitis or the Wegener's granulomatosis. Okay, so in this condition, basically there are C ANCAs. Okay, and these C ANCAs are basically the IgG antibodies, right, against the neutrophils which are having the proteinase 3 in their surface. Okay, so this is the illustration of what I've said just now. That is the B cells, they are synthesizing the antibodies, and these antibodies are basically they are stimulating the neutrophils which are having the proteinase 3 to produce what, or to release the oxygen free radicals, okay, which are the ROS, and these free radicals in turn would cause the endothelial injury. Okay, and this would lead to the granulomatosis with the polyangiitis, which is the condition. Okay, now the pathogenesis is that it is a cell mediated hypersensitivity reaction, and it can be stimulated by inhaling the environmental antigens. Then the effects are it basically affects the middle-aged males, right? And the nasopharynx, okay, now it's gonna have a triad effects. It means that it would affect the nasopharynx, lungs, as well as the kidneys. So in the nasopharynx, it would cause the necrotizing granulomatosis, granulomatous inflammation. Okay, NGIs stand for this. And in the nasopharynx, it causes the chronic pain in the sinusitis. There's a bloody mucus from the ulcers and the saddle nose deformity. In the lungs, however, okay, it causes the breathing difficulty, right? And it also causes the necrotizing granulomatous inflammation in the lungs, right? And the ulcers are also occurs in the lungs, so that leads to the bloody cough. And in the kidneys, there is no necrotizing granulomatous inflammation, right? So this restricts the blood to the and yes, it leads toward the restriction of the blood to the glomeruli, right? And there is decreased urine production and increased blood pressure, and the treatment of the GPA is that we give the corticosteroids and the cyclophosphamide to the patient, but the relapse is very much common because the C anchors are still present there, so it can lead to relapse. Then we have the second type, which is the microscopic polyangiitis. So, okay, now what are the features of it is that it doesn't affect the nasopharynx, okay, only the kidneys and the lungs, right? So here you can see it is not basically, okay, so this is a differentiating feature of the microscopic polyangiitis, that it is only affecting what, the kidneys and lungs, but it is not affecting this nasopharynx, right? And there is no granuloma in the microscopic polyangiitis, right? And also a differentiating feature of it is that it has the P anchors, right? The P anchors are basically P stand for the perinuclear, okay? And in this case, basically it is synthesizing the antibodies against what, the neutrophils which are having the MPOs, which are the myeloperoxidase, okay, myeloperoxidase enzyme, right? So okay, so this is the differentiating feature of it. And the treatment of the microscopic polyangiitis includes the corticosteroids, cyclophosphamides, and this is also this is a transmural necrotizing inflammation. Now the third type, which is a Churg-Strauss syndrome. So in this case as well, we have a P ANCAs, and which are the IgA antibodies that directly affect the endothelium. Okay, so now what are the clinical features of the Churg-Strauss syndrome? So these are sinusitis, lung and kidney damage, GIT. Okay, so lung and kidney damage are the important clinical features, right? But it can also affect these areas like the GIT, skin, nerve, heart damage, right? And there is increased use of eosinophils in the Churg-Strauss syndrome, right? The granulomas can also form in the Churg-Strauss syndrome, and they're the similar. Basically, the symptoms are very much similar to the asthma allergies. So it means that in the patients who have the asthma as well as the increased eosinophils, so they are more prone to the development of the Churg-Strauss syndrome. Okay, now the last type, which is a Hanlock Schonlen purpura, HSP. So in this type, there is no ANCAs. Okay, so it is non-ANCA associated vasculitis, and basically the IgA antibodies are increased here, and these antibodies, they are formed from the mucosal cells of the lungs as well as the GIT cells, right? The symptoms include, basically the symptoms depend upon the location that where it is occurring, right? For example, in the skin, if it is involving the skin blood vessels around, so around the buttocks and the legs, so this would cause the discoloration of the skin. And if it is affecting the GI tract, then it would lead to the abdominal pain. And if it is affecting the kidneys, then it would lead to the hematuria, right? As you know that it is blood in the urine. Okay, then we have the purpura. What would be the characteristic of the purpura, that you can feel it, and it would be from the fibrosis. Okay, and usually this HSP resolves on its own, right? But the steroids, they can also be given for the for the severe cases, right? So that's all from my side. Okay, and if you have any questions, so you may ask in the comment box. So thank you.